Welcome to the Stuck Pig Academy of Medicine. We discuss all things medical preparedness with a focus on austere care. These episodes are recorded during my Patreon classes. If you are interested in joining, use the link in the show notes. This podcast cannot and does not contain medical or health advice. The medical or health information is provided for general informational and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based upon such information, we encourage you to consult with the appropriate professionals. We do not provide any kind of medical or health advice. The use or reliance of any information contained on the podcast is solely at your own risk. All right, and welcome back. We have a double feature today, 2 chapters at once, a little menage a trois, if you will.
I won't.
But with book chapters.
I really won't.
So we just left off on chapter 4. We just finished chapter 4, and we are going to today talk about 5 and 6 all at once. This one's going to be interesting. Good discussion, I think, with this. And so chapter 5 is titled Healing Without Medicines, which in today's day and age, I think is a very interesting topic. But somehow that can be a negative thing to discuss, I think is very interesting. And the first thing that I highlighted, as always, is generally what they put in bold at the beginning of the chapters. So we have people will get well from most sicknesses, including the common cold and flu, by themselves without need of medicines. They put it in here because I'm assuming for the most part this is also true outside of industrialized, outside of the industrialized world, and in some of these third world countries or underdeveloped nations. It's definitely true here, by and large. Most medications for most sicknesses that we have treat signs and symptoms. They don't actually treat the root cause of the disease. And it continues on.
Yeah, common things being common. Yeah. I mean, even thinking back to like something I heard on the Prolonged Field Care podcast, I don't remember exactly how the numbers were broken down, but even in battlefield trauma or prolonged field care, I think they broke it down to where, and this is very rough, but it's like 1/3 of them will get better no matter what you do. 1/3 of them will die no matter what you do, and 1/3 of them you'll actually make a difference. Those are very rough numbers, but I think that's about what they put out there. Actually, I feel like the percentage where they talked about it matters whether you do something or not is actually lower than 1/3, but that's just my rough remembrance of that.
Yeah. And the next thing that I had highlighted and then written something down, it says often, wow, let me put that on Do Not Disturb. Apologize if you guys heard that. Phone very angrily vibrating. I highlighted on here is keep clean, get plenty of rest, eat well, and drink a lot of liquid. And then I wrote in take a knee, drink water, change your socks. It just simply doing those things. There's a reason why like military medicine says that, because most people don't think about like taking care of those simple things like in the middle of certain activities, and just simply taking the time like during a movement, during a ruck, especially a non-tactical ruck, like if you're just training or whatever, taking a moment, even if it's just halfway through, just pausing to change your socks, sit down, clean your feet off, get new socks on, reapply the antifungal powder, and then drink water. That hits all three of those. You're keeping clean, so you're trying to prevent the growth of foot fungus, and you're also trying to decrease the breaks in the skin through blisters and other different issues. You're getting a little bit of rest by taking that knee, or sitting down on your pack, whatever it may be, and then you're drinking some liquid and potentially eating like a little snack. Because most
what
people
is
don't
it?
think about those things.
If you if you don't have to run, walk, if you don't have to walk, stand, if you don't have to stand, sit down, and if you don't have to sit, lie down. I think I was doing a little bit of reading on, I believe I don't remember the Army publication number, but it was basically the infantry platoon and squad, and talking about sleep cycle and recommendation on, you want preferably 4 hours of uninterrupted sleep, and then if you are going to interrupt that sleep, you want at least a total of 5 hours, which, when you think about that, that's going to start affecting how many people that you need to have with you in a given element to be able to make that even possible.
It pretty drastically, and I don't know if we've talked about it, but I know other people have talked about it in our circles, about this whole myth of the rugged individual when it comes to situations that we're preparing for. It's just simply a fallacy. It's not possible. Just simply looking at how are you going to sleep?
Yeah.
Like, you have to be someone has to be doing watch while you're taking rest.
Yeah.
It's just a requirement.
Think about in a hospital, that's usually staffed on 12-hour shifts. I don't know, but I think most factories and industrial sites are staffed on an 8-hour basis. I don't know much about
depending. 8 to 12 hours is generally the norm, depending on a variance of factors.
So for any given task that you need done 24 hours a day, it's not like a 9 to 5, you're doubling or tripling the number of people that you would initially think about for that task. I mean, a guard post is a really easy example. Same thing for running a nurse's station. Depending on the length of those shifts, you're going to need double or triple the number of people that you just think about, like nurse to patient ratio or whatever.
Yeah. And that's not even including time to do other tasks outside of just that one thing. The numbers can start to get pretty insane.
This is one of the things I was thinking about recently, as far as it's very easy for everybody to get sucked into, and it's not wrong to think about doing your own livestock, doing your own agriculture, things like that. But if you have a skill set that's already applicable to a post-event scenario, you should also be putting a fair amount of energy into being able to do your job in an austere post-event environment. Like I have colleagues of mine that they're getting into the chickens and ducks and the rabbits, and that's cool. But now I'm talking to them about, all right, where do you source your prescriptions or your supplies that you can have for your own, basically professional use, just outside of your normal working environment. And it's just not something that I think, or if there are providers that are thinking like this, they're probably unlike me. They're probably not talking about it. But I don't think it's something that's that really gets thought about a lot. Because as far as have a skill, if you already have a pre-existing skill, try to refine it where it works.
Yeah.
But anyway, I'm getting more than a little off topic here.
Yeah. It happens. It's part of the allure of this podcast, is that we do get off topic.
Yeah, it's part of it. So real basics here at the beginning of chapter 5.
Yeah, it is the body that must overcome the disease. The medicine only helps. That is, I didn't highlight that, but it's bolded. I think that's fairly an important concept to kind of remember. And then the other thing I highlighted was the art of healthcare, because I think that's a pretty apt description of what it is that it's kind of an art. Not really abstract, because that stuff's dumb, but it's definitely a refined.
Yeah. I mean, there was an article that went up recently on American Partisan, and it's basically a story about a failure of camp hygiene, right? And
Yes, I read through that.
yeah, so the author, there were a couple of things that I pointed out in my comments on it. Um, the author says like, okay, this is an E. coli infection that you could only diagnose with like a lab, right? It's like, well, yeah, technically, but this, the art of medicine is partly making those intuitive, well-founded, but intuitive leaps of like, all right, this is our setting, eliminate the other possible causes of what's going on. This is not the flu, it's not respiratory, so everybody's getting diarrhea. Eliminate foodborne, like cooking in, sources, and then, all right, well, likely this is what's going on. So you can make kind of an intuitive leap to make your diagnosis. You don't have to rely on the hard science of like, oh, I must have. I mean, we're not billing Medicare here. We're billing insurance. We don't have to have lab results to back up our diagnosis. You're just trying to take care of your people.
Yeah.
So I feel like that to me is also part of the art of medicine.
That's where like a good quality history really comes into benefit, because then you can use that with signs and symptoms, duration, and not even necessarily if you don't have the ability or the knowledge to sit there and remember like, oh, I know the gestation period of this is, X amount of days. But you can just write those things down and then go do research later when you're coming up with your plan or your idea, and like look through and be like, oh, this thing that I thought it was has a very similar gestation period. The signs and symptoms all seem to match. And anything that has a similar like profile doesn't make any sense for the area that we're in. That doesn't exist in this part of the world. It's not the right time of year. They're missing several key like signs and symptoms that would lead you to think it's X over Y.
Yeah.
And you can really use that to get a pretty narrowed down idea to the point to where, okay, I know the medication for what I think it is going to fix it. And I know it's not going to hurt what it could potentially, like, it's not going to hurt them if they get it, if it's potentially this other thing. And that's a lot better than just simply like, well, I can't do anything because I don't have labs. Like
Yeah,
there's a median there.
yeah, I think the reliance on a lab to verify your clinical diagnosis, or imaging to verify or confirm your clinical diagnosis. We've gotten very, very comfortable with that and gotten very uncomfortable with relying on our clinical acumen.
Yeah.
All right. So many sicknesses can be prevented or treated without medicines. I think that's true if you're considering the fairly minor illnesses.
Yeah.
If you
But
get
even
into
some of the more
blood,
aggressive ones,
yeah, or more aggressive
lifestyle things, for a lot of those, I think. And then obviously there's exceptions to this.
yeah, or even
Um,
relatively minor issues that become, like a minor cut becomes a wound, can become septic.
mhm.
All right, now, the further along you go, the more complicated that's going to be.
Yeah. The big thing of this chapter seems to be, and this is the kind of highlights it, and I highlighted this sentence, that if people simply learned how to use water correctly, um, that this alone might do more to prevent and cure illnesses and all the medicines they now use, and misuse. Water is really important, and that's kind of like the whole rest of this chapter is like water and why it's really, really important.
Yeah,
And
and
kind of
all its
goes through, yeah.
all its various forms, liquid, gas,
Mm-hmm.
and solid.
And we talk about contaminated, which they, define as basically unclean. And it's often part of the cause of a lot of diarrhea, which is, massive cause of death in underdeveloped nations, among children. Diarrhea is huge, and it's just because water's not treated correctly, by and large.
And the use of water isn't necessarily something that you're drinking directly, like even just for travelers' diarrhea, or you're
Mm-hmm.
just like going overseas. It's like not just drink bottled water. In our little trip to Guatemala, one of the points that was thankfully made to us was, hey, when you're like doing your dental hygiene or use any kind of water to wet your toothbrush or whatever, however you brush your teeth, use your bottled water for that too.
Yep.
Um, anything where you're putting that, like, and don't talk in the shower. Yeah, because like you don't want that water anywhere in your mouth, or no.
Yeah.
So things like that we don't really think about.
Yeah.
Ways you do not want to ingest contaminated water.
Yeah, that buccal membrane is real good at absorbing anything that's in the water.
Yeah.
And it talks about boiling water. And again, like Teddy was saying, not just for drinking, but for other things. Like if you're preparing food with it, which I know a lot of people, their answer for food storage, and rightfully so. It's one of two answers by and large for the most part. It's either beans and rice or freeze-dried foods, both of which require a very heavy reliance on water
Yeah,
to do
or
things
like
with.
Glenn Tate's 299 days. He very specifically, when he's doing his pancake mix and his pasta and
Yeah.
all that stuff, he very specifically went for something that only requires hot water or boiling water to prepare, which is not a bad plan. It's like, all right,
No, it's not.
you don't need.
Well, as long as you don't live in
don't.
a desert.
Yeah, yeah. If you live in Washington State, that makes a lot of sense. Particularly west of the Cascades, that makes a heck of a lot of sense. But versus like, oh, when I need butter, I need eggs, I need milk, I need oil, all these extra things to make this recipe, like to make this work, right?
Yeah.
So keeping things relatively simple, but even so, if you do need to cook with it, you're gonna have to consider your water source, and you're probably gonna have to purify a lot more water than you initially think.
Yeah,
Same thing.
absolutely.
I mean, you can't. There's no sense in washing your utensils or your dishes with contaminated water either. There's 0 point in that.
Yep, absolutely. And if you look at like historical societies, by and large, most of them didn't drink water. They would consume either like tea or fermented beverages of some kind, because that fermentation process kills like the bacteria that can hurt you if you do it correctly, obviously. And that's why like beers and wines were very popular and not like a modern like IPA that's like 18, or a stout that's like 18% alcohol by volume for a beer. Like old school beers and ales and things were like 2 to 3%, which is a very, very ridiculously low alcohol content. And when you're doing physical labor, it's something you can consume a lot of throughout the day and not get intoxicated off of.
Yeah, there's a reason that like so much of like Mediterranean culture and Central American culture that kind of brought this over to Central America was like wine was just so common. Is a little bit of alcohol content, make it safe to drink.
Yeah.
On hydration, dehydration, Koala Bear did have a comment on that. She annotated her copy of this. When they talk about giving lots of liquids to a child with diarrhea is more important than any medicine. She did comment on, avoiding hypertonic fluids, juice or tea will cause continued osmotic diarrhea. And just to kind of explain what that is, osmosis, of course, is just where you have something that's in a higher concentration on one side of a membrane than the other. And so if you have something in your gut it's going to pull water into your gut because it has more sugar, more salt, whatever that is, it's going to pull water into your gut. And now you've worsened your problem.
Yeah, absolutely. That's a really important thing to bring up.
And then
it just goes through a whole list of times when the right use of water may do more good. And it talks about prevention, cleaning, bathing, washing with soap and water, specifically clean water, filtering or boiling drinking water, which boiling is just such an easy thing to do, to just simply, as long as you're below that elevation.
I've heard 3,000 feet.
Whatever it is, as long as you're below. If you live above that, you probably know that, because if you've ever had to deal with a burn notice, they talk about it. Or probably if you live in that area and you've moved recently, probably all of your neighbors will not shut the fuck up about it.
I think maybe when you say a burn notice, you mean a boil water.
Boil notice. I apologize. Yes, a boil notice.
I do like that show.
Yes. Some very
Boil water notice.
quality supporting actresses involved in that.
Sure now.
Then we have treatment, and most of this is just, for all these different things, drinking a lot of water, and then also breathing in like hot water vapors.
So that goes back to don't just think about water in its liquid form. Consider water in its vapor form. And like I think we're all pretty familiar with, taking a saucepan and starting to boil water, and mom puts towel over your head and just trying to get that moist air into your nasal passage, just try to get that mucus a little more thinned.
Yeah, the whole concept of a nebulizer. Introducing in. Yeah.
It's the same concept as when like oxygen concentrators come with a water tank. Of course, you have to be careful that water is not getting things wet and growing mold. Which I believe Philips had a recall on a CPAP machine for that reason.
Probably.
A couple years ago.
Yeah, that's a big thing with CPAP use, is making sure that things stay sterile, and also, which is part of the issue with the ventilator use during COVID, is that a lot of people were dying to secondary infections of pneumonia from being on the vents, and also some other things, not just dirty stuff being used, but other issues with that as well. Talks about hot compresses, not just for infected wounds, which is really important for that, because you're basically like heating and bringing more blood flow to that infection, but also for sore muscles and joints. Kind of the same concept as like icy hot.
Going back to the infected wounds, what you're trying to do is draw all that pus, those dead immune cells to the surface into one focal point, so that it'll either make its own exit, or you can just give it a little help and just cut the skin right over that little pimple, or the pimple. That's what most people have experience with. But that's what something on my surgical rotation, the surgeon would do. It's like, all right, well, it's like let's put lots of compresses. It's not quite ready to drain yet. Let's put nursing orders for lots of hot compresses, warm compresses, and let's try to get all this material to the surface. Where and then we can drain it. Absolutely.
And then we even get into for minor burns, it said hold in cold water. I crossed that out and wrote cool. I'm pretty sure that's still the same from what I learned. Is that you don't stick burns into cold water because it would cause a temperature shock.
I am not sure on that. I think that I remember reading something about cold salt water for burns. It was something that was discovered during World War II, where you had what's that? Yeah, so we had RAF pilots getting shot down over the channel, and the ones that ended up in the water with burns did better than the ones that didn't. So I think what you're looking for with the, putting a minor burn in cold or cool water is, or cool water, you're trying to pull heat out of that. You're trying to stop that thermal damage. Because a burn is still hot, right? You're trying to keep that, pull heat out of it. I want to go back up real quick to 6 on the skin infections and using soap and water. That's certainly a good way to help prevent those kind of infections. But ringworm, which they mention, that is a fungal infection, and unless it's really mild, those won't necessarily respond without antifungals. But it may also be self-limited anyway. So hygiene is probably better as a prevention for that than anything.
We have gargle with warm salt water. It's for sore throat and tonsillitis.
I think we're all pretty familiar with that.
And just an eye rinse for any sort of substance in the eye.
Yeah, I think the word here is copious. Like when
Yes.
we're thinking about
Yes.
that, it's like you need to, whatever amount of rinse you think you need more. It's kind of like ammo or
Yeah.
magazines. It's like when I went to that one class, I didn't know if we were gonna have somebody get a stick in their eye or something. I got at the grocery store or Walmart or wherever it was. I bought 2 of those saline flush bottles because I was like, we're not messing around. Like we're
Oh
just gonna,
yeah.
unless
Yeah.
somebody gets something in their eye, we're just gonna flush that thing. And even
Yeah.
if it's an irritant rather than like, let's say it's a chemical, let's say you get poison ivy oil in your eye and not a physical foreign object. You're gonna want to try to rinse as much of that oil out of there as you possibly can.
Yeah.
The illustration for sniff salt water just tickled.
Yes.
Sniff salt.
Yes. And then, drinking lots of water for constipation, hard stools. Also talks about enemas.
So
And that would be specifically like an enema without sodium or salt in it, different from like a rectal IV, to make sure that because you want that enema effect for that.
yeah. A comment that I have from Koala is laxatives have become significantly safer since 1992, which is I believe that's the last time this was, at least my version, last time this was done. Miralax in particular is basically impossible to overdose except by causing dehydration. So
Yeah.
there's gonna be some things where it's like, well, yeah, kind of, but not really. So it really depends. I mean, I would be really depends on what you're doing. It depends on the age of the patient too. I mean, laxatives, from what she's talked about, laxatives are really contraindicated in the very young. No, they're not. Oh, okay. So a stimulant laxative versus an osmotic laxative. Okay, gotcha. Okay. Okay. So it depends on like which laxative I misunderstood. Which laxative you use depends on age. And then for 16, we finally get around to my much mentioned solid form of water, basically just ice. Essentially, just talking about ice to a blister for cold sores or fever blisters. I think what they're kind of trying to approximate is when we use liquid nitrogen to freeze a blister. I'm not sure how much ice you would need to really freeze a herpetic lesion enough that it would, like a cold sore, which is what it is. I don't know how much ice you would need to freeze that to where it would scab up and fall off.
Yeah, I don't really know. Especially with the common like distribution of the cold sore treatment kits, so you can get them at Walmart and the like pharmacy area.
Yeah, I will say this as an alternative. I think maybe another, if not better, illustration of the use of ice is as a topical numbing agent.
Yes.
You don't have lidocaine, or if you're going to inject lidocaine, first you numb that injection site with ice.
Yeah.
That's kind of a gimme.
Yeah, especially if you add ice or add ice to the ice. Yes. If you add salt to the ice, that can help it achieve a colder temperature. Just like if you're, making old school ice cream.
Okay. Yeah.
You add
Yeah.
salt to the ice.
Because I'm guessing what that does is kind of like adding salt to pasta water to get it to boil faster. If you add salt, I guess if you add salt to ice, it freezes at a lower temperature.
I'm not 100%. I would have to.
Those ions would have to interrupt.
Or at least it just helps keep it from melting.
I think it must be because if the ions disrupt the lattice, it'd have to be colder to freeze in the first place. So it's gonna take, that temperature is gonna have to come up higher before it starts to melt. So it's basically your ice it's a way to get your ice colder to start with.
Yeah.
I would imagine. I don't know. Maybe we can have a physical chemist
It's
comment.
so what this says is that it can drop the temperature from freezing or 0 to as low as -21. And it gets lower when ice melts. Energy heat must be absorbed from the environment to overcome the hydrogen bonding, holding the water molecules together. It's an endothermic process. When you add salt, you alter how readily water can refreeze back into ice. In pure water, ice melts, cools the surroundings and water, and some of the energy that is absorbed is released again as the water returns to ice. At 0 degrees, ice melts and freezes at the same rate, so you don't see ice melting at this temperature. Salt lowers the freezing point of water. Among other processes, the ions from the salt, yep, there it is, get in the way of water molecules aligning to crystallize into ice. When salted ice melts,
And
the
found
water
it
can't
here.
refreeze. Yeah.
Science.
Yeah. So as the ice melts, it's absorbing more heat through basically
You started
science.
you started at a lower temperature to start with, and so
Yeah.
it has to pull more heat out of that tissue or the environment or your hand in order to melt. I mean, if you ever stood on a cold concrete floor barefoot and felt that concrete sucking heat out of your feet,
Yeah.
it's like, yeah, it's a real thing.
So learning has occurred.
Learning has occurred. All right. I think it's, regardless of the issues that I'm going to bring up next chapter that we're going to talk about, I think I don't think anyone is going to have too much of a bones with their concluding sentence for chapter 5, which is use medicines only when absolutely necessary.
They got to start you off like just gradually before it's like an abusive relationship. They just kind of like slowly ease it in before they just like
can't get used to this idea. The key there is when is absolutely necessary. Like when is that? And that's really where your level of experience and comfort and honestly what your resources are. That informs all of that.
That is the $64,000 question right there.
Right. So
getting into chapter 6. Right and wrong uses of modern medicines. Oh boy. Oh boy. Oh boy. Oh boy.
Told you this was gonna be a fun one.
And this was because it's still the same for, I just checked the front of mine. The revised edition was May 1992, and the 15th printing was in 2017. So it says, and this is in 1992, 60,000 medicines sold in most countries. WHO says only about 200 are necessary. Now, to be fair, that's for maintaining life. It's probably not extending quality of life to levels we have in.
I would kind of like to know how they're counting medicines. As far as like, okay, is this different brandings of the same basic medicine?
No, it's not.
It really is. Okay.
It's individual drugs, not different isomers of the same one.
Wow. Okay. And not just rebranding.
91 as of July 26th. This was the biannual release coming out.
So how many?
591 for adults, not counting the pediatric list.
Okay. Are in common, are necessary?
Yes, that's essential medications.
Right. Okay.
To the MSF, that's what they carry.
Gotcha.
It covers everything you can think of. There's anesthetics, anti-plastics.
Right.
There's like the congenital heart disease medications for neonates.
Yeah.
Are now considered essential.
So 591 for adults alone. Okay. So my question is the 60,000 medicines. I'd like to know how they're counting that. And I'm wondering how much of that is rebranding of the same thing, like Tylenol in the US is paracetamol in the UK.
It's probably separate formulations, like each individual formulation.
I mean,
its own drug.
I did not dig far enough. This document is hundreds of pages long. I did not dig enough into this to figure out how they were counting total, or if they even are counting total formulary anymore. I'm not sure they are. It wasn't published, obviously.
Yeah, that is just a really big number.
This is exactly what I was. I was almost expecting like MLA format, like cites, like sightings on this chapter for the response. That's the fact that, yeah, I'm not surprised that went that in depth to find. Everyone's really familiar now, after the last 3 years, and the recommended or essential medications list from the World Health Organization, because on that list of medications is the wonder drug ivermectin, that everyone loves to hate and hates to love.
Regardless, this has been a gold standard for 50 years. So regardless of what else you think of WHO, that has backing to it.
Yeah,
Yes.
I mean, I tend to, this can be a trap too, because you get stuck in old thinking, but I do tend to have more faith in things that have some background to them, that have been around and stood the test of time. And particularly if there's no obvious financial element to it.
Well, we don't really
Yeah.
Right. It's like everything that's like generic or things like that. So yeah, I see it. I think we're kind of getting into there is some danger in the use of any medicine. It's like, well, all right, I have to think, okay, I have to kind of take a step back from this, right? Because that is a very obvious statement to me, but I realize this book is not written to me or even necessarily written to someone from the first world.
Yeah, this is.
So
Well, I would even say there's a lot of people in the first world that don't understand that medications can be dangerous.
that's fair. I do appreciate that there's still some people that I interact with that are like, I don't want to take any more medications than I absolutely have to. I'm like, I'm with you. Let's go through here and see how many of these are the same class or the exact same drug at different strengths and sort that through. So, all right. So never use a dangerous medicine for a mild illness. We'll get chloramphenicol here for a second. I will say, I already like modern medicine. They don't have to sell me portraying them as bullets coming out of a gun. I mean, I'm already a fan. Just saying. That looks like a water pistol to me. But anyway, just touching on chloramphenicol because they kind of give it a hard time. They talk about, chloramphenicol given for a cold. Well, chloramphenicol is an antibiotic. As we talked about quite a bit before, any antibacterial given for a viral illness, unless you're really concerned about a secondary infection, is inappropriate. But chloramphenicol is one of those medications that most Americans are not going to have heard about. It's an old medication. It got a pretty bad rap for some side effects and some bad outcomes. And so it's really stopped being used in the US. It's much more widely used elsewhere in the world. And so it's actually developed some drug resistance in the third world, whereas it doesn't have a lot of drug resistance here in the US. So it can be an option, if you were inclined to go that way. But let's look at this for a second. Do I have that up? All right, I have this up on Wikipedia. Let's just look at our numbers here and just kind of, I want to demystify a little bit of the chloramphenicol thing, because I was always just, all I remember, kind of my gut reaction to chloramphenicol is bad. That's all I really remember from med school about it. So the side effects are or potential serious side effect is something called aplastic anemia. Has to do with your blood count. But let's see what else. Highest risk is with oral, so a pill, chloramphenicol. It is a 1 in 24,000 to 1 in 40,000 incident rate. Okay. Lowest risk occurs with the eye drop formulation, which is a less than 1 in 224,716 prescriptions. So just kind of let's quantify our risk, right? 1 in 24,000 at the highest, 1 in 40,000 at the low end. I mean, if you've got something that's resistant to everything else, and your patient's going septic on you is going to die, well, that's a relative risk there. Bone marrow suppression, let's see if they'll give you, that's really a dose dependent thing. So it really depends on how much you're giving to reach a toxic level. Leukemia, did they give any hard numbers on that? So risk of childhood leukemia is increased with increased length of treatment. So they don't go into more exact detail. Gray baby syndrome. This is probably with IV chloramphenicol. This is probably why it was discontinued because of use in infants and having adverse outcomes. Does not go into the numbers, but it does. One of these things that this can be prevented with drug level monitoring. Monitoring the level of the drug in the blood, which is probably going to be something beyond an austere provider's ability to do, granted. Then there's hypersensitivity, like any kind of allergic reaction to any kind of medication. Neurotoxicity, again, they don't give the numbers, but they talk about eye and peripheral nerve irritation after long-term therapy.
Yeah.
So that's just kind of it's really kind of portrayed in what I remember from modern medical education as this like, you would never do that. Why would you ever do that? It's like, no, there might be contexts in which it would. So
Yeah.
I just want to stand up for a second and just like say, hey, chloramphenicol, like, it's not all one way or the other.
Painting with a broad brush is never accurate.
All generalizations are wrong.
Yes.
All of them.
And then we have guidelines for the use of medication or use of, I keep on saying medication. It's medicine. So use medicines only when necessary. Know the correct use and precautions of any medicine you use. See the green pages. And then we get into be sure to use the right dose. And what that triggered my Neanderthal caveman brain. What that like flashed back to was the 5 R's, which I somehow got right and only had to look up to verify that I did have the correct 5 R's. Granted, it might have taken me 10 minutes to remember all of them, but I did remember them. Right dose, right route, right person, right drug, right time for medications. And those are the 5 things you need to check before you push a medication to any patient.
Man, that's giving me flashbacks to Handbook's YouTube channel, because he talks about exactly that. He talked about that in the context of giving an intramuscular injection without aspirating to double check that you're not unintentionally administering an IV, which that aspiration technique has fallen out of favor.
Yeah, apparently it's a no. I angered some people at my last AT when I was still in, because I went to go aspirate and they were like, what are you doing? And I was like, making sure I'm not in a vein. Like, just push it. I was like, okay, I understand you work in an ER, but let's like settle down.
Yeah.
I'm pushing Recefin. Like, let's just relax. Like,
Yeah.
I promise this guy's not going to die in 15 minutes. Like, we're good.
It's not gonna hurt the patient, and you might prevent a medical error.
I was like, what's the harm in doing it? Well, you don't need to. Are you sure? Did the Army develop X-ray vision when I wasn't paying attention?
What I understand is that you don't need to was what was extrapolated off of a study in pediatrics. As far as like safety and efficacy.
Yeah.
Which was it was extrapolated off of a study in pediatrics that was then extrapolated to everybody.
Yeah.
Which, pediatrics are not just tiny adults. It's anyway.
One thing I've kind of noticed, I can't speak if it's a recent trend. I don't even want to say practicing medicine, because I don't even do that. I play act medicine at my level.
How I feel. You don't get
And
good imposter, you don't get really good imposter syndrome until you do STU rotation. It's like, what presser do you want to give them, doctor? Do you want to give them Levofed or you want to give them blah blah blah? And I'm like, what are those and how are they dosed and what do you usually do?
um
You've been working in this ICU for 10 years and I just got here.
but one of the things that and again, like I said, I don't know if it's a recent trend or if it's cyclical, which there's a very high probability, but I've noticed within the last 3 or 4 years, especially in like emergency and like trauma emergency medicine, there's this big thing where it's like hip and cool to be, I'm practicing evidence-based medicine, man. I read all the studies, man. And like one study will come out and they're like, it's contrary to everything we've learned about everything. So we're going to change everything right now because of one study. It's like, okay, no, what this means is we need to have an open and honest discussion about some preconceived notions we might have had potentially, but this doesn't mean we need to stop doing everything we were doing and just like immediately change because one study came out. Like, it's just the one. Like, let's wait until like somebody else is like, let's see if we can recreate that study to see if it actually is real and not just like a one-off. Like the whole like scientific method sciencey thing, I don't know. And that's just for me at my level. But there's this thing where like people, like somebody reads one article and they're like, we can't ever do it like that again. That's wrong. And it's like,
I had one very a very practical piece of advice on this topic from an EM doc I rotated with, and he's like that you never want to be the first adopter of a clinical practice, and you don't want to be the last. You want to be like right there in the middle. I was like, that's extremely pragmatic.
I mean, that's very fair.
It's like,
And especially in the litigious society in which we live today. Let me go ahead and over enunciate my words since people are listening to what I'm saying.
No, it does go to what you're saying as far as like if you're just looking for the hot new thing to change your practice and just do something entirely different just because it's the hot new thing. Well, that's no more correct than, like sticking to what you've been doing for the last 20 years despite all the evidence to the contrary. Right?
Oh, yeah.
Neither one of those is
a lot of
different.
This is not specific to medicine either. Like it happens like how long did my last Instagram account last? 2 months? 5 months? Maybe 6?
You get bombed.
Oh, it was I already had to make like a fake email and then like use my computer to make the second account. So now I have to like use a VPN and like another fake email. Because the VPN blocked my phone and my computer from making Instagram accounts.
Yes, I am your mathematic.
So, but on one thing I noticed on there, and it's not just unique to Instagram, but with how quickly information is shared on that platform, it's very easy to see this cycle of things going through. And like we have like there's especially now there's a lot of like Zoomers that are coming in that they're becoming old enough to buy guns. They're getting into guns. They grew up on Modern Warfare and all of these different like first person shooter video games, and they're getting into guns and doing all the things, and they're like, well, you should have, like, they read like they'll read a post on something or see something and like, well, you have to do it this way. It's like, no, man, you really don't. Like, things are a lot more fluid, and there's just like this cycle. Like we went through like LVPOs were like the hotness for like the last like decade.
What was it?
And then like ACOGs are like coming back.
Dunning-Kruger.
Yes, the Dunning-Kruger, just enough to like not know what the fuck you're doing.
You know nothing, then you learn a little bit, and you're moving x-axis going left to right is knowledge, y-axis is confidence, and I think that's right. Yeah. So you go as you move right. There's this massive shift in confidence and dogmaticness with it, dogmaticity. In what you do know, it spikes, and then you learn that there's a whole lot more that you're just getting started, and so your confidence drops again. So you think you know nothing.
Plummets.
and then you actually can kind of start actually learning at a more maintainable rate, right?
Yes. I
I
remember
feel
at
like
one point in time, I thought anybody that carried a 5-shot J-frame revolver was an idiot. And here I sit before you with a J-frame 5-round snub nose in my pants right now as we speak. I'm not doing I'm not getting into gunfights and
look, sir, pants. Look, sir, J-frame.
like it's just it suits my needs just fine. Would something be like more better? Yeah, but that doesn't mean it's not like what I'm carrying right now isn't a right answer. Like there really isn't like the right answer. There's like several.
It's context.
Yeah, and medicine gets into that, and I've seen that with people where they're like, well, this one study came out and it said this. And it's like, okay, we have 6 decades of studies that say other things. So who's right? This one study that says this one thing that has yet to be verified or tested. Like, yeah, it went through a peer review process, but that doesn't mean that it's right, because Vioxx went through a peer review study or went through a peer review process, and that turned out to be a shit show.
You also have to look at, like, all right, where do these guidelines come from? Did they come from any kind of formal study? Is it consensus of experts? Is it like, all right,
Yes.
you got a whole bunch of people that have been doing this for 20, 30 years and just kind of get the majority of what they kind of think based on their experience? I mean, how hard a line is this? I mean, before you get real dogmatic about something, like just do a quick search and look at, like, all right, what is this based on? Because there's a whole lot of not a whole lot, but there are a number of bases for a guideline or a recommendation or something like that. And it can go from a massive clinical trial to just kind of consensus of experts, kind of a consensus to, and that doesn't mean everybody agrees on everything. That just means it's kind of the majority. It's the consensus opinion, right?
Yeah.
To, oh, well, we have this one anecdotal, like, well, we have this one case study, right, for something super rare.
Yeah.
Or it's the question's never been asked. There's always that too. It's like the question's never been asked, and so we're just doing the best we can.
And sometimes you try to have that discussion. Some people are more open to it than others, but it's everywhere. It's not just unique to medicine. Well, I learned this new shiny thing, and that means everything we knew before then is wrong. I had it happen when I was in the Marine Corps. We had an issue with a defensive system. There was a length of coax that was ridiculously long, and it ended up being the cause of a gripe that actually that aircraft changed squadrons with the gripe on this radar warning system. And we had checked a bunch of stuff. We just had not checked that section of coax for some reason. I can't remember why. It was a massive, like 200 plus foot length of coax. And we had to pull that entire piece of coax out, pull one off another aircraft that was already downed for another reason, and replace it, and then just leave an open work order on the other aircraft to put, when we got the new one in, to put it on the other bird. And we sent a couple dudes to a wire repair course, and they come back from the wire repair course and they were like, oh, hey, did you know we were idiots and we didn't have to replace that entire length of coax? We could have just repaired it. And they're like telling us like all the stuff they learned, and they're like, oh yeah, we're so cool because we know all this new information because we took this 4-day wire repair class. And I'm like sitting in the back, and these are two newer, like younger CDIs. And I was like, well, congratulations. You guys can finally use the wire repair manual. I'm glad you know how to do that, because it's about fucking time. But if you were to actually like know what you're supposed to, we can't repair those coax because the manufacturer says we don't have the test equipment to properly check to make sure that we repaired it correctly, because the tolerances on the resistance is so tight. You have to use a micro ohm meter to test it, and all sorts of other like crazy test bed stuff that we don't have access to. So per the manufacturer, we're not allowed to repair that cable, and we have to send it in. And they were just like, oh, it's like, don't jump the gun on things. Like, let's slow down and use some critical thinking skills and think through some things.
Yeah, I mean, I think it's just kind of in the nature of young people to
Yes.
either to rediscover something or think they've come up with something new.
Yeah.
I mean, it's very.
Yes. Yeah. I mean, I was on Instagram when the with a personal account when I saw the tactical community change from like urban CQB being like the hotness and like 10.5 rifles with EOTechs
Mhm.
being like the thing, and like if you had anything more than that, you were an idiot because you can't clear rooms with a 20-inch barrel, even though there's a bunch of Marines that would that were took part in Fallujah both times that would like to have discussions with you on clearing houses with 20-inch barrels. But then all of a sudden, like CQB became like homosexual, and like Recce became the new thing. And everyone was like, you need an LVPO or you're gonna get like killed, or an LPVO or you're gonna get killed in the streets or killed in the
I don't know
woods.
where that came from. I mean, I
Um,
remember my first introduction to the concept of an LPVO was reading one of John Mosby's books, and he was talking more about the general preparedness rifle. He was just kind of
yeah,
he's like, all right, this is something where you can take varmints, you can take predators.
it came from the competition world. They were
Yeah.
using LPVOs because they had changes, but at the same time, it's you still can't take what you learn from competition and 100. It's still like there's benefits, there's things you can learn. It's a simple way to stress test. It's not the end all be all. It's not like the benchmark that we should grade everything on, but it's a decent place to start. And they were pulling things from that and like, oh hey, like we need to do this and we need to do that and we need like this stupid ridiculous 5-pound AR and
So, so it's like it seems to me, I was listening to the FNG Academy, and they were talking about night vision and different, like you got your quad tubes, you got your dual tube singles, etc., and how a lot of the really cool and like streaming video off of a scope back to your talk or whatever, like all these cool toys, right? That starts with tier one, trickles down to the rest of soft, then trickles down to main force. I would argue that a fair amount, particularly in like gun accessories and like LPVOs are a great example. Techniques and tools often start in the competitive world. And if they're either if they're pressure tested,
yeah,
Soft was running LPVOs for specific roles.
yeah.
But it's really easy for this to become again the Pakistani hamburger of, oh, they have this, so I'm gonna, like I'm the guy that had a 1-4 LPVO on his 10.5 pistol.
I mean, it just simply for PI for the ability to make PID at even 120, you can really like, is that actually a gun or is that just a cell phone?
Yeah.
There's a lot of talk with and I know like oh god, primary and secondary we're talking about, especially with these new light offerings from like Mod Light and Cloud Defensive, with LPVOs being now viable for law enforcement, because with these lights you can at night PID at 200-300 yards. Cool, that's law enforcement. I'm not law enforcement. And it's this taking things with not understanding the context of them. And but I remember I think it was about 2018, it was around when the goon thing started going on, when that whole trend started, and like the doomer trend. 2018 2019 was around when like this whole like recce thing became popular on the internet, and everyone was like, CQB is dumb and we don't need to worry about that. And it's like, well, like to a point, like by and large, like
So
I'm not.
so you're saying this that's pre-existed 2020?
Yeah, this is before 2020 that these things
Okay.
were happening.
Because I guess I would have thought like, oh, after you see 2020 and you kind of get the sense of like, all right, I'm going to withdraw from this environment because there's
That
no way I
definitely
can win this.
streamlined it and made it mainstream. But it was already happening before. It was slowly gaining traction on its own, and it probably would have gotten to the point that it is now organically. But the overnight, like, just floodgates getting opened was, the summer of love,
Yeah.
in 2020, and that really opened a lot of people's eyes to things.
Yeah, I 100% agree. I mean, these things do go in cycles. I think again, that's
Yeah.
just human nature. Everybody, we all think that we're the first one to come up with something.
Yeah,
We're all the
absolutely.
little kid that's like, oh, look what I found, and your parents were like, yeah, dear.
Yeah.
Right.
But
So,
it's
let's
way
talk
off
about
target. Yeah, let's get back to
talk
drugs.
about the granted, most of our audience probably also has their own thoughts on what we were just talking about, but let's get talking about what we actually put on what we put on the tin for the
Yes.
podcast. The most dangerous misuse of medicine. So I'm gonna have some issues to bring up, augmented by some of Qualibear's notations on here. Again, chloramphenicol they bring up and saying it's really only used for did they say typhoid? This is old information. It is used for anthrax at this point. It can be used for that. And again, this is written to people working in the mountains of Mexico, where this is, chloramphenicol is a super commonly used drug.
Yeah. And with
So
this being like
kind of-
1992, this is pre-anthrax being a big concern. Now in Africa, in certain areas, that is a naturally occurring
the
thing you
cowhide,
have to be concerned with.
cowhide shields or other cow. Well, I'm thinking like the movie Zulu. I guess that's what I jumped to. But yeah, just
Yeah.
hides and things like that. So welcome to our new chappy. So then they're on page 50. Oxytocin, ergotamine, and misoprostol. The book says, unfortunately, some midwives, it's not just midwives, use these medicines to speed up childbirth or, quote, give strength to the mother in labor. This practice is very dangerous. It can kill the mother or the child. Use these medicines only to control bleeding after the child was born. And then they have a reference to page 266. So no, we've talked about obstetric practice and like the more non-medicinal or the over medication of labor. But I think this is kind of we're talking. When I was reading this, I'm kind of talking past me and the author are talking past each other.
Yeah, talking about different things in different contexts.
Because I mean, oxytocin or pitocin is used to augment labor frequently. That
can be argued it is overused.
Can be argued. It's usually put at a low drip, either to kind of get to get labor going along.
Yeah.
And also that's usually used when you've either had rupture membranes, so you don't want this you don't want this this baby going unborn for too long, like usually I think 24 hours, because you're concerned about the infection risk. And then as they say, like, we usually typically, like, after baby is delivered, we're going to turn up that pitocin significantly so we can get that uterus to contract down, because that uterus, as we talked about before, the uterus not contracting down is our single biggest risk for postpartum hemorrhage.
Yeah.
Cytotec is used, so they're talking about Cytotec in the context of misoprostol in the context of like an oral medication. Cytotec, what I've seen is just like use this little part of a pill placed up against the back of the cervix to, quote unquote, ripen the cervix, and it's just to get it to thin out, soften and thin, to encourage that cervix to dilate and get labor moving along a little faster.
Yeah.
The danger there is if it becomes a matter too much of the laborious convenience, if that comes at any kind of risk to the patients.
Yeah, absolutely. Yeah, that's always going to be a tricky thing, and a tricky subject. And then we get into injections of any medication, usually better when taken by the, or belief that injections are usually better than medicine taken by the mouth is not true.
This really depends. I
It
mean,
really depends.
I feel like we're rubbing up against a cultural belief that we're not party to.
Yeah, there probably is some stuff that, so like from my experience and my my preconceived notions that I bring to the table, when I think about medications, specifically injections, I'm thinking about trauma mainly, and then I'm also thinking of like very specific like steroidal injections that we would give for musculoskeletal injuries.
I'm usually thinking about sepsis.
Yeah. Well,
That's usually when I'm thinking about injected antibiotics, I'm
yeah,
thinking I need to get I need to get
quick,
this antibiotic into the bloodstream because that's where the infection is. That's where this patient is going into shock because the cells that make up their blood vessels and are usually tightly knit are turning into a spaghetti strainer, and all their fluid in their blood and they can't maintain their blood pressure. So we need to get that antibiotics where the infection is.
Yeah, absolutely.
So that's a big one there.
There's probably some underdeveloped areas to where just simply any medication, because like it's okay, yeah, pill, I can get this, like especially in countries where pharmacies are not controlled to the level that ours are. Like a perfect example, Mexico. You can buy all sorts of shit in a pharmacy in Mexico that you cannot get in the US, like even at all, let alone with a script.
I think maybe one of the risks that they're talking about, they're not saying it specifically, but is like necrosis around the injection site.
Yeah, and so there's with like the accessibility to pills being as high as it is, there's probably some sort of idea that like, oh, like that's like everybody like has access to that, but like, oh, pill like injections, oh, that's a this must mean this is a medical professional. This is like some high level stuff, kind of similar to how like in the Middle East, everybody has a rifle, but only captains of death squads have pistols. And so like if you wanted things done, like you like pulled a pistol out, and that like people looked at that differently.
I mean, lots of militaries, officers carried pistols, and it became kind of that symbol of rank, more because they've got a bunch of boring administrative things that they need to do, and keep their hands free. But this is I think from page 69. This picture of this kiddo with injection site necrosis.
Yes.
Yeah, so I think that might be what they're going for.
Yeah, that's my in this type of setting, that's my concern, and that's why I don't super hyperfixate on injectable meds, IV
and it may
bags.
not even be about the meds. I mean, they're talking about like if the site's not clean.
Yeah. So what I was trying to get at was saying that like I'm not super like hyper focused on those things because it requires a lot more. Like you have to have needles, and you have to have the correct size needle. And the right length of needle, and whether it be like catheter, filter, just straight needle, all these different things start to come into play when you start talking about needles. And most people are like, huh? I thought you just used a needle.
Yeah.
It's like, well, no, like this is why like heroin addicts get, necrosis and lose.
And it's a whole separate tool set. It's like, oh,
yeah.
Okay, I need a crescent wrench. Okay, I get a crescent wrench. You need a different size crescent wrench. Socket wrench. There we go. Socket wrench.
Yeah.
I have a socket wrench. Cool. Well, that's the wrong size. Wait, what? There's more than one size? Yes.
Yes.
And that's in metric, and I need standard. What?
Yeah, absolutely. And I mean, there's a reason why the DoD took the IV out of the CLS toolkit, and why it's no longer a CLS skill, and it's for like a whole litany of reasons. There's a whole bunch of stuff, but I'm pretty sure infection concern was probably like you don't need to give like a 19-year-old 11 Bravo, like in addition to him having a machine gun, like a literal machine gun, like a belt fed, like now also you have needles in an IV bag of questionable storage that might be expired. The tubing was probably opened like 6 months ago because he got bored and he wanted to look at it, or the IV bag is gone because his buddy got hungover
I
before
will
PT.
say, man, this is how do I say this without sounding like an old fart? I trust a 19-year-old 11 Bravo with a machine gun because what he's going after that machine gun, he can see and conceptualize. He understands what his target is. Like when you get down to like micro level and needles and stuff like that, it's like, how much do you understand?
Yeah.
Like your forebrain is not finished developing. I'm not sure.
Yeah. Especially with medicine not being his primary job.
You know,
A little different than a 19-year-old medic.
Yeah, you can only train somebody in so many things, right? And then
Yeah, especially at that
okay.
age.
Now that I've ticked off any potential Zoomers, it's like, oh, fine, man.
Oh man. I mean, I can piss them off right now and just tell them that they're worse than boomers. But that's just from my own interactions. What I've not saying there aren't exceptions, because I've definitely at the G camp met several exceptions to that rule. But outside of that,
I guess I'm thinking more of hipsters when I say the CZ because it's won no world wars.
Yeah.
I don't know. I don't know what Zoomers like in handguns.
I don't know. Nerf guns.
Whatever's on the most recent video game, yes.
So yeah, injections are like they're a serious thing, and they're not something to mess around with. You can cause some pretty serious issues if you mess something, and that's not even getting into like IV issues where you start talking about like infiltration, blowing out blood vessels, pushing things that are pushing drugs that are meant to be pushed IV, IM, like causing a whole bunch of issues.
Like we were talking about, and just as far as that's why we should aspirate.
Yeah.
On the subject of penicillin,
sulfa allergies are a motherfucker.
Penicillin allergies. I mean,
or is psyllin a sulfa, or am I being dumb?
Sulfa allergies are legitimate, but
no, I'm saying is does penicillin fall under the sulfa umbrella? No. Okay. Yeah. So I was retarded. I apologize.
It's okay. Let's take a moment here. So penicillins are part of the larger beta lactam family. So that includes and I probably won't be comprehensive in this, but your penicillins and your cephalosporins are those are two of your big ones.
Yeah.
I'm trying to think of what else fits into that off the top of my head. But those are your two big classes of beta lactams. Sulfa drugs are based on an older antibiotic technology, and your most common example that I've run across is sulfamethoxazole trimethoprim, which is marketed to humans as Bactrim. I mean, there's fish sulfa forte or fish sulfa, I think, on Fishmox, Fishflex. It's also sulfamethoxazole trimethoprim in the 160 formulation.
Yeah. I could have sworn I saw it say something about sulfa in here. Maybe I'm thinking of something else that I read.
Probably, as far as
I read something else.
It is, it is a fairly common source of allergies, but penicillin is also so just to comment on penicillin, particularly penicillin IV. So group A and B strep and syphilis are the only drug of choice indications. So that's where those are really the only for penicillin. Those are the, you got syphilis, you got group A or B strep, penicillin is your go-to. It's one of the things when you're doing labor and delivery, and if you are able to, like 25% of women are group B positive strep, GBS positive strep, strep positive. So why, it's all for why do we care? During a vaginal delivery, if baby is exposed to that particular bacteria, they're more likely to develop meningitis. Same basic reason why you don't want active herpes lesions along the birth canal, because then they get viral meningitis. But at
Yeah.
least with that back, if mom is not it's not an infection, but a colonization, it's just part of her normal perineal skin flora. So obviously you're gonna use iodine, you clean that area. But you're also going to treat with penicillin, and that's really your best option to get mom's skin flora down
Yeah.
under control so you can avoid that meningitis. So we are slowly picking up crew members here on the good ship Lollipop.
And we have gentamicin, another antibiotic, anti-diarrheal medicines with hydroxy. Oh God.
So
Quinolines?
before we move on from gentamicin, just real quick note from Qualavera on that. Single dose gentamicin does have potential for hearing loss, which is what they cite here, as well as kidney, not for nephrotoxicity, kidney damage.
Yeah.
You basically want pharmacy support for getting your peaks and troughs, which is just your dosing.
Yeah.
So ampicillin and gentamicin is still the preferred combo in neonatal sepsis due to AMP alone having limited activity against E. coli. Also is staph and Pseudomonas active. So it's not, yeah, you can have some hearing loss with gentamicin if you go too high. And you can have, and it can, some antibiotics are nephrotoxic. This is why if you're not sure, talk to someone who you think might know.
Yeah.
All right.
No, absolutely. I mean, this just goes back to telemedicine and consults and just how important they are.
Yeah, and honestly, trying to, even if you just had, family practice notebook downloaded, it's a free resource. Is it as up to date as up to date? No, but it is free, and it's pretty good for most things.
It's better than the one you don't have.
Yep.
And we go on to anti-diarrheal medications, specifically with, and I'm going to butcher this, hydroxyquinolines.
Yep.
Hey.
Hydroxyquinolines.
Quinolines. There we go.
Just say it with confidence. It's like metoprolol. Just say it with confidence.
Treating for diarrhea, dangerous, now prohibited apparently in many countries. Can cause all sorts of bad things.
So comment from Qualiver on this. I can't find that this is still a thing aside from vaginal flora conditioning used as a suppository.
Yeah. And they've talked about in this book before, like, and this is stuff I've heard before, is not giving this is something I've heard from a doctor that actually has spent like extensive time austere with Doctors Without Borders to not use antidiarrheals. If somebody has diarrhea, it's for a reason. They're trying to get rid of something. Just let it take its course.
Yeah, like Imodium or loperamide. That's actually something I commented on to that earlier discussion of field sanitation. I was on one of my comments on that was like, yeah, you can treat it with this and this, and don't use Imodium because all that diarrhea is trying to get out for a reason.
Yeah,
and you trap it in the gut by inhibiting that normal peristalsis. You're going to cause more problems.
Yeah.
The good news is your problems are over. The bad news is your problems are worse.
Yes. We get into cortisone and corticosteroids, prednisolone, dexamethasone, and others. Powerful anti-inflammatory drugs that are needed for severe attacks of asthma, arthritis, or severe allergy or allergic reactions. But apparently they're prescribed for minor aches and pains because they often give quick results. They do have dangerous side effects if used in high doses in multiple, like over more than one day.
So yeah, let's talk about that for a second. So dosing is very important of steroids, right?
Yes.
Typically we'll have it as a burst for like a week. or a taper where you start with lots of dose and steroid dose, and then you literally taper off every day. You're taking less and less
Mm-hmm.
over 5 days to 7 days. The issues become where you're taking steroids, like let's say you have an autoimmune issue and you're taking steroids for years. Depending on how you're taking it, what you're taking, you can start to have other problems. Simple example would be steroid injections into arthritic knees.
Mm-hmm.
If you do it more than, I believe the studies were showing, more than every 3 months, you actually accelerate the degradation of that joint.
Oh, wow.
So that's usually like, well, it's like I always felt for my patients who, their shot didn't last but like a few days to a couple of weeks, because I can't in good conscience give them more steroid injection until that 3 months is up. Otherwise, I'm contributing to the problem.
Yeah.
Because it lowers your inflammatory response, but it also lowers a lot of that protective thing. And it does lower your immune response, and it transiently elevates your white blood cells. So that's one of the things. If you're looking at a white count on a complete blood count, and it's really high, the first thing you have, and they don't appear sick, the first thing you have to check is like, hey, have you been taking like prednisone, Medrol dose pack, any kind of steroids for any reason?
Yeah. We didn't use a lot of, I mean, we did use corticosteroids, but it was very rare. It was only for very, very serious like injuries that we would have. Guys would like really mess up their knee pretty bad, mess up their shoulder, mess up their back, and we would give them something for that. But it would be like we would give them the 1 dose, maybe 2, while we were at AT. And then that was it.
Yeah.
We weren't doing like repeats every day, like none of that, and not for minor things either. By and large, for the most part, for minor like aches and pains and sprains, the pain's generally a good thing. It can tell you, like, pain can tell you a lot. What's that?
Keeps you from re-injuring it.
Yeah, that too. It keeps you from re-injuring it, but it also can give you like a clue into how well things are healing and if the issue is worse than you originally thought. And so just kind of letting things heal on their own is generally by and large the best course. And then also you don't have to worry about because again, like we talk about infection rates right now, the reason why like heroin users have such bad infection rates is not just because they're using dirty needles. It's also because their hygiene is absolute fucking garbage. That also plays a pretty significant role in it.
And their nutrition can't be good.
Yeah, no.
I mean, how much vitamin C do you think? I mean, I'm just saying.
Maybe that's why the ones in Florida are all like so like overpowered, just because there's just orange trees everywhere. They're just
the vitamin D and the vitamin C.
Just the super tweakers.
Zombieland 3, the super tweakers.
Yeah, I mean that's just LA, Portland, and Seattle. And anabolic steroids, apparently in third world countries, people give them to their children to make them grow faster.
Yeah,
that's wow. Man, cultural differences are wild, because that is holy shit. Because the big thing that they talk about in this is, and we'll talk about it here in a little bit when we get to the next page, but like, don't waste money on things that you can do better jobs with, like food and proper nutrition. And because I know Conan talks about it, and he's talked about it in some of his articles, and he's talked about it to me because I've talked to him quite a bit on exercise and nutrition. Was that don't worry about like going out and getting the supplements, especially like starting off, like just
we had
eat,
an episode of Radio Control where he mentioned just a few essential amino acids.
Yes, yeah, because those are important for recovery.
Yeah, and essential in this context means something that your body doesn't produce itself.
Yeah. But like for the most part, just like good healthy nutrition will do like, and the other benefit is it's self-limiting. you're not going to get as bad of protein farts and some of the other side effects from consuming too much protein, or not too much, but like in abundance,
Something
when
I
you're
want
just consuming it naturally.
Yeah, something I want to touch on real quick on this whole thing, like why you don't give anabolic steroids to children. And part of it is just like, all right, let's talk first about like boys and girls are different. Contrary to what you've been told recently,
That's how you know this book is from 92 and not 22.
given who wrote it.
From what we
I
read in the
I-
beginning of this book,
Yeah,
I have a
the
feeling.
real problem with the need for anabolic steroids is the misappropriation of land. Yeah.
Well, I was going to say the misappropriation that we should be giving testosterone to the little
Yeah.
girls, and
Oh, yeah. So anyway, girls, pretty much anybody, like, kind of remember high school days, like you were coming along as, for the guys, they'll remember this. You're in your adolescent years, and the girls, like, they're maturing like way faster. Like you're still kind of got your gangly boy body and pimples, and the girls are starting to get their woman bodies, right? Well, girls, like they hit puberty and they gonna get this hormone dump at an earlier age than boys.
Mhm.
And boys come on, and girls get that hormone dump, and their growth plates, which are just that part, they're for each long bone that you have, and even some of the short bones, if you count the finger bones, each of those long bones has a growth plate on each end, and that's really where the lengthening of the bone happens.
Yeah.
If when you get those growth hormones, or in this case steroids, introduced, those plates seal. When those plates close, they then kind of callus together, and there's no more growth. So you get a little bit of a boost in growth, but once those plates close, no more growth. So this is why you absolutely do not want to give this to a child. And like if you give it to a boy, like he'll get that maybe a temporary boost in growth, but he's going to end up much shorter than he would have otherwise. Given
Yeah.
time to develop.
Yeah.
That's
Man.
why sometimes you got kids who have big autoimmune issues where they have to have steroids to live. They
Yeah.
don't get for that reason, because they had to have those steroids.
Yeah. God, it's just so crazy. I don't. Wow. That's a man. Anabolic steroids to kids. Wow. When we get into arthritis medicines, butazones, and that's about all.
Paula
Yeah.
Bear had a comment on that. Causes aplastic anemia, no longer approved for human use in the Western world, with extremely rare exceptions for treatment failure. And that's just talking about these various arthritis medicines. And we're not talking about ibuprofen or meloxicam. This is for like rheumatoid arthritis kind of thing.
Yeah.
Okay. Okay. So vitamin B12, liver extract, and iron injections. The book says do not help anemia or weakness except in rare cases. Also, they have certain risks when injected. Should be only used when a specialist has prescribed them after testing the blood. Also avoid injectable iron, such as interferon. All right, so her comment on this is iron sucrose / dextran infusion is useful. Otherwise, a 3 to 6 milligram per kilogram dose for pediatrics, 325 milligrams for adults, 3 times weekly. It is constipating if more often, and no improvement in the hemoglobin. So what I like, being on my end of like working with adults, if I'm dealing with the elderly, if they're anemic, they're taking their iron supplements, just an over-the-counter iron supplement. And yeah, if you take it every day, constipation is an issue, but you don't actually get any extra benefit from taking it every day. Take it every other day or 3 times a week, then you're going to get that iron. You're going to absorb all of that iron, but you're not going to get kind of more than your system can handle.
Yeah. I would say, especially for this, like some of that, the constipation issues potentially could be exacerbated with people using an abundance of cast iron that they might not have been using before. Because it's kind of like the go-to prepper cookware is
I mean,
cast iron.
you're definitely gonna get more trace iron in your
Um,
diet. I don't know if it would be enough to constipate you. It's like that's actually one of
yeah,
those
I
things that I
all I
actually
know
one of
for
those things I
that is that it
recommend.
can get into your bloodstream. I know that because I know people that have hemochromatosis and they cannot consume food very often, if at all, that's been
Sure.
cooked on cast iron. So
Sure. I know. So for somebody who, yeah, who can't, um, basically can't, they get too much iron in their bloodstream just because they
mhm,
won't do the normal turnover of blood cells.
yeah.
Sure. For most people, cooking on cast iron is probably not actually going to be a bad thing for them at all. It's actually one of those things that I've recommended to folks. If they don't want to take an iron supplement, like we'll continue, consider cooking on cast iron a little bit. You'll get some of that trace
Yeah.
iron. If that's something where they are anemic. The B12 that they talk about, B12 deficiency can cause a different kind of anemia, where you can throw all the iron you want at this person and it's not going to fix it. Uh,
Mhm.
and that can be more common in people who've had certain gut surgeries, because if you had part of the gut taken out, um,
Yeah.
then you're not absorbing iron well. Well, you're not absorbing the B12 well because you're not secreting intrinsic factor. Anyway, I'm nerding out on that. Um,
We go
all
on to the 52 on the next page, 11. We have other vitamins. Do not inject vitamins. Injections are more dangerous, more expensive, and usually no more effective than pills. And this just kind of hits on, again, like we had talked about before, the nutrition thing. Just buy quality food ingredients. Same thing with food storage. Now, to caveat that, I know it's common for people to recommend multivitamins, and the answer is always, well, all you're doing is buying expensive urine. Yeah, you're gonna pee like quite a bit of that out, but like to say that none of that is getting into your system, I think is a little asinine. Again, I think it goes back to like they read like a Reader's Digest article once that was like,
I remember reading that in a little physical fitness booklet on getting, trying to max out the PFT. I remember there was
mm-hmm,
a comment about that. Um, I really wish I knew what the nutrient and vitamin value is left in freeze dried food, and I don't. There's
I know in
probably
freeze dried food it's generally pretty high.
okay.
Um, because all it's taking out is the water.
Hmm.
Um, and if I remember correctly, it's not taking any. That's right. It's not taking anything else out with it, because it's skipping like the way it's skipping that. Science words, point of convergence. Um, you're going below that when you're freezing it at a vacuum at like -40. Um,
Again, it's just not
and
something
then
I'm
you
very
reheat
much
it.
about.
It's skipping the way freeze drying works is you freeze it, you pull a vacuum, and then you reheat it in a vacuum, and it skips the liquid stage, and goes straight from a solid to a gas.
Hmm.
Because that's we use it in you use it in the production of certain like in freeze dried medications. That's
Right.
the steps.
Right.
And in freeze dried food, if I remember correctly, it has, if not all, very close to all of the original nutrition. The other thing is canning. That's where you'll lose a lot of nutritional benefit. But even still with the freeze dried food and stuff, they say to like, oh, you just add, or if you're not gonna, like if you're doing the beans and rice thing, just adding in some multivitamins. And yeah, so maybe you don't get that much out of one, take two.
Yeah.
As long
I,
as you don't. So again, there was the disclaimer in the beginning, don't try to come after me, but this is also said with grain of salt, without any like severe medical issues, you're probably not going to run into any issues from like quote unquote hyperdosing a multivitamin.
I think that one of the deficiencies I could see a lot of people running into is a simple vitamin C deficiency. Because
Pine needles,
pine needle tea, yeah.
pine beer. That's what the natives did. That's how they handled fighting scurvy, and it got passed to French trappers, which then got passed to English settlers, and pine, even though it's not technically a beer because there's no barley or like hops. It was just the name they gave it. And they would make a tea, and then for like long-term storage preservation, and for them long-term is not the same. So you see people, and this is, oh god, words have meaning, and meanings change over time. It's crazy. When you see things talking about like things they did in the old world for long-term food storage, they weren't storing things for 30 years.
Get them for a winter.
It was for 6 to 8 months. Maybe 2 years with some of like the salting of meat products, but even then they weren't holding on to it that long because they knew in the summertime they were going to be producing.
For them, like they were producing more of their own food, which sure is an admirable goal. Is that something that most people who want to try to protect themselves in the future or from the future are going to be able to accomplish? Less likely. So what they can do is like, even though the dollar doesn't buy what it used to, you can store food still at a reasonable price. You know, it's doable. It's not ideal by any means.
And then also taking the like the community approach, or what I've heard referred to as the hubstead, instead of the homestead, where it's like one family on a piece of property trying to do all the things. You have multiple families, kind of going back to that like multi-generational family aspect that we had on farms and in other different areas, where it's not just one, like it's not just like a dude, his wife, and like 2.5 kids in the picket fence in the middle of nowhere. It's like 8 families. So like one family, like they focus on cattle, and another one focuses on goats, and another one like grows, and everyone has their own small little garden. Like one guy, like he grows massive amounts of like X crop and like a grain or something like that. And like one person like focuses on like this for food production. And I read something, and I don't know how valid it is, but it makes sense when you like think about it, especially like at a massive scale. If every 4th household had 3 to 4 chickens, there would be no need for the egg industry in the US. And then if every 10th family had a dairy cow, there would be no need for the dairy industry in the US. Now, obviously in certain areas, you can't really do that.
Yeah.
But it's an interesting thought experiment to like, man, that's not that much.
It puts things into a conceptual scale.
Yeah.
Of course the issue with the multifamily or hubstead is who's in charge, basically, for lack of a more delicate way to put it. Where those can form around some sort of shared ideology, usually religious framework. When it's an extended family, it's usually the patriarchy, or the matriarchy in some cultures, but it's usually like, all right, daddy or granddad or Uncle Hub or whoever it was says this is what we're doing. All right, this is what we're doing. And that's just been, how that works. I mean, this is like everything from like, the people of my homeland in Central Appalachia to the people of Afghanistan. Who, it's kind of a joke, but like everybody, like the cliche of like, every time a Hispanic person introduces you to another Hispanic person, like, oh, this is my cousin. I'm like, sure, okay. It's like these big extended families, right? That's how, that was the other example. The mafia. It's like, it's like, this is like very, very, so that's how you get a bunch of in the, how that just kind of runs into the issue of like, how do you get an extended group of people
Yeah.
all working toward the same goal? And anyway, this is not, I know it's a very interesting little sidebar in there.
Yeah.
So basically, the kind of bottom line is, with your storage food, don't just think about calories, think about nutrient
Yeah.
value, think about nutrition. And if nothing else, I mean, you can go the vitamin route.
Yeah,
if you have
it's a step, but again, you're gonna absorb more of those nutrients through food.
Yeah.
This is why to me meat makes so much sense. Especially things like ruminant animals. You're taking something that, like grass. If I were to eat grass, I would die. But you take something that eats that and ferments it and processes it multiple times through its, the ruminants, and all of a sudden we have some of the most nutrient dense food known to man.
Yeah.
Man,
Cheese.
it's almost like if it was by design.
Cheese,
Well, not even just cheese, but the meat.
But the meat too.
The
but
meat
like
itself, but yeah, the byproducts,
but even the
Mhm.
friend of mine who ran a dairy, he would like hold a piece of cheese and it's like condensed sunshine.
yeah, pretty much.
Sunshine
It's
to grass to milk to cheese.
yeah, and it's long-term storage. Like
Yeah.
it's, and again, within that context of like storage being for them a year, not how we think of long-term food storage in multi-decade timeframes. And that's how you have to think about those things, is like kind of you're having to use and replace them regularly. Just like the food in your fridge. Like you don't look at your fridge and like, this is going to last me a year. You're like, this is probably 3 weeks worth of food. Some of the things like the condiments and the stuff in the door that just gets like forgotten about. That stuff can last you a while.
It's never going bad.
Yeah, no. And I found out through personal experience that mustard does not require refrigeration. Because thanks to my child, we have in the glove box car mustard, as we refer to it. We have a smaller container of mustard that is the car mustard, because she consumes mustard at such a high volume.
We need to have a patch just says car mustard.
Car mustard.
See a little bottle of mustard.
Oh my god, that's amazing. Oh, Jesus Christ.
Ridiculous inside joke, but this is car mustard.
Because like we'll go out to places and be like, oh, you need to put mustard on it. Like so for like the people that have been in North Carolina, like we'll go to Cookout, get the junior tray with the hot dog. Or if she's feeling really hungry, we'll get them full-size tray with 2 hot dogs. And we'll ask for mustard. Sometimes they put extra mustard on there. Sometimes there's barely any mustard on there. So you take the car mustard and you slather that on there, and you ain't got to worry about a fussing 6-year-old. You just
love that phrase. So I reached over the glove box and pulled out my car mustard.
Yeah, that's
I didn't do the car mate. What is a car mustard? I've heard of like a CW9 and a P40. What is a car mustard? No, you don't understand. This is like the spicy mustard. Oh, is it like a Soup's 38 Super? No.
It was a small unknown contract for the Hussein family. Oh, I went there.
Combination medicines. They basically just take a giant
I have problems with some of this. Because the cough medicines are like, it doesn't treat the cold. Well, yeah, no shit. But you know what? I don't want to be miserable when I'm already going to be miserable.
Part of this is like function. As we've talked about before, is like part of it is just why I function better with my symptoms treated. But even just the fact that like they just don't. All right, maybe it's just combination medications that are improved. I mean, the number of combination the combination blood pressure pills that I see, or combination COPD or respiratory inhalers. It's like, I think maybe it's just improved a lot in the last 30 years. I'm giving credit.
Yeah, I mean, I remember growing up, I was like, my parents always told me like, oh, don't get the Mucinex DM, because why would you want a cough suppressant and an expectorant at the same time? And it's like, okay, stupid. So you're not going to cough as much. And when you do, it's actually going to be productive. I'm sorry, the Reader's Digest article you read said something entirely different, but let's not do that. Because I've used them a bunch. I mean, growing up, it was always like, well, you never do that. And I'd have like, there's probably 2 decades of my life that I'll never get back that I was just miserable when I had a cold and an upper respiratory infection.
It made you the man you are today. Cough syrup deficiency.
There's probably some other things that happened in that first 2 decades of my life that we can probably attribute to
that's your
a little bit more
right there. My shortage of cough syrup. How I became
I just want some Mucinex DM, man. That's all I want. And then I learned about it and we started using it, like I was given it, and like I was like, damn, I'm not miserable. Where's the pill version? But that's so syrups, I would generally not, if at all possible, avoid storing those because they don't store very long at all. The pill form is generally the way to go. Certain, broad brushes being what they are.
Koala Bear's comment, and this is remarkable, as I believe it is the only positive comment she has for this entire chapter on regarded cough medicines. It is, amen, use honey.
Yeah. Yeah, I mean, if you're just trying to if you're just trying to like soothe your throat, yeah, by all means.
Yeah.
But
like, I mean, it's definitely it's an anti-fragile solution.
Yeah, it is. I just mean I always have a couple boxes of Mucinex DM now because I've had times where it's like, dude, this is like, it's like when every couple years when I do get the flu, and I'm like, oh god, this is rough today, boys.
I think I was handing out some like Dayquil capsules the last Scott Recce course I was at. Like some of the guys are just coughing. It's like,
but having the suppressant to where you're not coughing, and then like the dextromethorphan to like when you do it, like you're actually like you're getting some relief because you're pushing some shit up. Just that simple, like, okay, I'm still miserable, but I'm not like as miserable as I was before, and I can function and do things, because there's that's a huge,
just for the context of running around in the woods doing sneaky things, some cough drops, so you're not like, okay, we're laying here in the woods, and
because I love Sam's Club because I don't have a Costco near me. Yo, Costco, if you're listening to this, fix that. Put one in Eastern North Carolina. Really appreciate it, big dog. I would buy so much. No, there's one in like Raleigh, and that's a little too far, and it's also Raleigh.
We don't really have Sam's Club here. We do have the internet.
There's like 6 Sam's Club. Well, there's just the convenience of going in the store, and like me being who I am, I can just ADD and be like, ooh, that looks cool. Ooh, that looks cool. And it's like, I went for like 2 things and now I'm like paying $400. What the fuck?
Yes, that's one of the reasons.
The other thing I like about Costco, and this is something I got from Scout, he kind of introduced me, and I don't know if they still have them because it was years ago that I like got hooked on these temporarily. They had like a cold brew coffee in a can that was just cold brew coffee. No, nothing else. Like that could be benefit because he was Robin Sage, where it was pretty miserable and we were pretty fucking tired. Get a couple of those, cold brews in you.
You have to sell me. I already want to do Robin.
But no, I just pulled up on my Sam's Club big bag of Ricola. Please don't sue us. I think this falls under fair use.
Ebola, copyrighted Ebola.
But Ricola is great. It's got menthol. I need my menthols in my lotto ticket. I need my menthols.
Menthols.
I need the menthol Winstons. The North Carolina Trailer Park Special. Those in Newports.
Trailer Park is universal.
It really is.
So to paraphrase the character from The Expanse, everywhere is the trailer park.
Yeah.
Trailer
And then
park
this,
is,
I don't understand this hate for the 2 or more pain medicines like aspirin and acetaminophen.
well, I
What's the hate
don't,
on like the combo? Because I know like I've used like I've given those. Like I
I
had a doctor tell me to
don't.
give those.
I don't know. I mean, because I think the person that's writing this does not understand that different pain medicines work different ways. That
Nuh-uh.
Tylenol is the same as ibuprofen.
Nuh-uh.
Like,
They're all the same. They're all NSAIDs. They all do the same thing.
Yeah. So Tylenol is an NSAID? Yeah. Yeah. Okay. My feet needs a
I
little-
think somebody got a little too deep into the like Mexican witch doctor. Everything I learned in medical school is a lie.
Yeah, I think
thing.
somebody should talk to a pharmacist. I think maybe this chapter escaped being reviewed.
Or if it did, they just looked at it and they were like, yeah, I'm not doing that. And then just like
This is not the
went with
development
the
of data.
original, like didn't look at the edits and were just like,
Like,
yeah, no, I'm
this
not
is
doing
not
that.
the Mexican mountain I'm gonna die on.
Yeah. We have calcium. Injecting calcium into a vein can be extremely dangerous. Didn't know that.
Duh.
It can quickly kill someone if not injected very slowly.
Let's unpack that a little bit.
Because I know there's different types of calcium.
So Koala's comment is calcium only IV as a piggyback. All right, so let's kind of talk about some of the things we've learned from things like prolonged field care podcasts and things like that, right? So calcium citrate can be irritating to can cause vasculitis. It can cause irritation to the blood vessel, to the IV, that peripheral IV that you place, right?
Mm-hmm.
So if you're going to push a bunch of calcium citrate, you're probably going to need a central line. Same thing for potassium over a certain dose, certain concentration. Calcium gluconate, you have a much higher threshold that you can give peripherally, just because for whatever reason, just because of the irritating or toxic. I don't want to say toxic, but that inflammatory effect on the blood vessel, right? So I think the concern is like, all right, is this going to cause that IV site to become infiltrated? Is it going to just become like all swollen around that site? Don't know for sure.
Yeah.
But I think the other issue that they're looking at is, and I would be more concerned about this with potassium, is slamming calcium in because of the potential effects on the rhythm of the heart. It's like, yes, we understand that electrical activity is driven by protons, which is essentially just a hydrogen atom missing an electron. We understand that. And we also understand that certain, like on the left side of the periodic table is like your positive ions, your sodiums, your potassiums, your calciums, that those having positive charges will interact, will affect your concentration of hydrogen ions. And so that's going to affect your pH, it's going to affect how these nerves work. So yes, slamming any of these ions into bloodstream, probably not a great idea. We get that.
Yeah.
But
I don't, this is a really, again, I feel like a lot of these things we're missing context on. It's been a really common trend. A lot of things that they talk about in this book.
I'm feeling somebody injected calcium and burned the author.
Why are they pushing like what's this like obsession with calcium, like that they felt the need to, like is there some like snake oil salesman that's
they had some kind of really bad outcome, like a lot of things that are emphasized, like somebody had a very bad clinical outcome and they've never forgotten it, and so it really informs what they emphasize. I mean, I think everybody does that as far as like if it's anything that's at all up for any kind of debate. If they had a bad outcome, they had a bad experience, it it really affects their views on a given topic.
Yeah, it's man, that's just, it's so weird. I don't, again, like, just because I can understand like some of these other things that like we've talked about, like because they also kind of provide like the anabolic steroids. I could understand why somebody would be like, oh man, like I'm super weak, and in Mexico you can buy anabolic steroids like over the counter. Like I'm gonna take steroids to get stronger. And then they throw this curveball. They're giving it to the fucking kids. Like, yo, what? Like, I expected some things. I didn't expect that. Like, that's a bit of a curveball.
Yeah.
But this calcium thing, like, there's no like, because it's this random one with a skull and crossbones. That's not with the other ones.
I
That's the
feel
most
like
dangerous misuse. And so it's
Yeah.
just kind of here. And then we talk about like lime and corn tortillas.
I don't know what the order is here.
To because you're getting calcium out of that. And the lime's also breaking down certain things in the corn and allowing more nutrients to get extracted from the corn by your body. And that's a whole like thing, which is something to not be ignored. Like you might want to, like, if you don't know how to extract lime out of certain things, like you might want to have some stored up, and then you just kind of mix it in when you're grinding the corn to make things like that's, or cook it in it. Like that's a method. But like, it's just like,
This feels very specific. This feels like a
Yeah.
very specific problem.
there's context that we're missing. That would be nice because it would help inform some guided discussion, and fill airtime. Not that we have any help doing that at all.
No, we have our own rabbit trails for sure.
Yeah.
No, we're still trying to finish that last page. All right, so
It's so many sidebars.
we could have, like, I've got my like lieutenant, I've got like captain's bars. I got, sidebar here, sidebar on each shoulder, lots of sidebars.
Yeah, we get to feeding through the veins, intravenous or IV solutions, which is something that has carried over into the first world, and I do not understand it. To where you can go to like this weird like strip mall clinic and get an IV bag of things.
Yeah,
that I don't
I'm not sure.
understand.
I do remember. I remember there was a place I lived before where there was like a home health nurse practitioner
Yeah.
company, and one of the services they offered was like IV rehydration. Like, oh, are you kind of feeling down or whatever? Like, we'll give you an IV bag. I'm like, I don't understand.
I mean, I get it. Like, people are gonna pay money for things. Like, you got bills to pay.
It's like selling pre-made bug out bags. It's not what you necessarily what you need. It's what you will buy.
Yeah, I mean, that's
Okay.
yeah.
So
That's, but and there's a lot of weird stuff going on with this.
So
I do like how they talk about making the blood thinner. It gives less energy than a large candy bar. Doesn't help anemia or make a weak person stronger. I can go on to a whole tirade on why I don't like pasta water.
IV solution is fine as far as like IV hydration is fine if you can't keep down oral intake. That's okay. Can't do any of that. Yes, I know you have your preferred alternative route, but
and I've got science to back it up.
Trying to be fair.
I don't have this. I don't have it in MLA format, but I can cite my sources, and it's not. Trust me, bro.
I'm not discounting that. I'm just like, I'm trying. I always try to see where's this other thing from.
They're really pushing this rehydration drink.
And the IV, good. One thing, of course, I really wish I got a chance to look at this for the SAMHSA conference. That I think was a lab on fluid management and severe burns, because that is one of those things where you're going to do a lot of fluids.
Yeah, burns are a really unique thing. And then the other benefit with bags is actual drugs. And pushing and dripping medications. And then when should medicine not be taken? I thought we were just talking about when to not take. Or I guess those were specific things not to take, not when to. And then many beliefs about things they should not do or eat when taking medicines. May stop taking a medicine when they need. In truth, no medicine causes harm just because it is taken with certain foods. But you combine certain things with alcohol and stuff gets spicy quick.
Well, there is something called disulfiram-like reaction.
Mhm.
Where it's like you basically just like drinking alcohol is really unpleasant if you
Yeah.
take certain drugs. Disulfiram was specifically
Um,
developed to help people quit drinking alcohol.
There's one of them I know because I had my team leader right when I was getting out. He was telling me like he had because National Guard, we have civilian providers that we go see in our off time about issues, and he had back pain, and one of the medications, I can't remember if it was a muscle relaxant or something. It was like, hey, don't take this with alcohol because you're going to get drunk way faster. And he literally looked at his doctor and he's like, you just saved me so much money because I'm going to have to buy so much less beer now. Thank you for telling me that. And it's like providers, like they're not used to, like if they have no experience with like military, it's like you're not going to tell us not to drink and expect us to like follow that. Because you're going to see Pruno being made in two locations, prison and overseas military installations where there's no alcohol consumption allowed. We're gonna find a way. There's some like the two largest populations of people in the military is like poor white folk and poor non-white folk. And both of those communities are very good at making alcohol where there is none. Through a couple of different sources. Like you thought bathtub gin was sketchy. Oh boy, you have seen nothing on the gallon jug of apple juice that we're turning into prison wine in somebody's wall locker.
Nice. Couple comments on like prenatal, like pregnant and breastfeeding moms called or did make a comment on prenatal vitamins are particularly ones they usually the thing with prenatal vitamins is they have folic acid, which helps
Yes.
baby develop neurologically. They're not bad for anybody else. So if you're just gonna buy one multivitamin for pretty much anybody and everybody, just
Yeah.
buy prenatal vitamins. It's not for me, the guys. It's
Where there is no alcohol, I have my
Yes.
next book.
Yes. It would.
And on today's episode of Spam, we're making Bruno.
I mean, as far as money making ideas, it's not what they need. Again, it's not.
I have a feeling there would be a massive amount of APO purchases in the Middle East. Purchasing how to make alcohol books.
Yeah. Maybe you too can have your book show up in Ukraine as a training manual.
Oh man.
So we're in the home stretch here, page 54.
You can even use it on like on a cruise ship because you can't really bring in your own alcohol. I don't need to bring my own alcohol. I'm gonna make my own alcohol.
The do-it-yourselfer movement. Let's see.
Newborn children.
Yeah, checking doses for pediatrics. Yes, that's a good
Very
idea.
important.
All right, so Polar Bear made some comments on the whole allergic reaction part. She says penicillin allergy has a 10-year extinction.
That's where I saw sulfa.
Drops by 10% annually. Also, most recorded allergies are not true allergies. Always ask and if only hives, usually it's safe to give under supervision. So part of this is like children will get a viral infection that has a viral exanthem, like a rash or hive. We've talked about that before. And if they're just talking at the same time, then it's associated.
Yeah.
So that's right. Your sulfonamide. There we go. Yeah.
I knew I saw it.
I think I'd seen that somewhere too. All right.
I'm
there
not
was-
yet to the point of hallucinating things.
not yet.
Close. We're
It's fine.
almost there.
It's fine. All right, so they are correct in that Tylenol really doesn't irritate the stomach like ibuprofen can.
Mm-hmm.
So if you have a history of stomach ulcers, you probably want to try to opt toward Tylenol rather than ibuprofen or
Yeah.
Aleve and naproxen.
Mm-hmm.
What were they? Naproxen, yeah. So between those two, you were saying that naproxen is once daily, once or twice. Yeah, it's fewer pills basically. It's less exposure. So they have this rather catch-all comment about certain medications, including antibiotics, should be avoided in someone with liver damage, hepatitis. Yes, that is true. Same thing holds true for kidney issues, just depends on how those medications are cleared out of the body. What's that? Yeah, usually you can usually get away with a certain dose. Usually you're decreasing your dose, not necessarily just completely cutting it out. So aspirin, let's see, what did they talk about here? Tylenol is hepatically cleared by the liver, so that's where you want to moderate how much, I think again we've talked about this before, 3,000 milligrams per day to stay within a healthy range for the liver. Whereas something like ibuprofen, if you have compromised kidney function, it's not that the kidneys process that ibuprofen, it's that the ibuprofen will squeeze down, cause the blood vessel leading into the kidney to squeeze down, and you're decreasing the amount of healthy blood flow to the kidney, so that can make kidney damage worse. So no aspirin less than 12 years old, unless you have a condition called Kawasaki's disease. That's the one exception to that.
God, I could.
Okay.
I had a joke I wanted to make, but it'd probably be in bad taste.
So no specific contraindication. So they say never give sulfa to a person who's dehydrated. And then I wasn't familiar with that either. So you went and Bear went and looked to see if there's any particular contraindication for sulfas and dehydration. So
There's not, I don't know where that came from.
And they didn't cite anything. So
Yeah, I feel like there's a lot of anecdotal stuff that makes it into this book.
I mean, citations would be nice. I mean, you can overdo it, but citations would be nice.
Yeah, it doesn't necessarily need to be MLA format, but at least like a little bit more than just I wrote this
Take
book.
my word for it.
Like, yeah, there's a happy median.
Yeah, and again, we're not reading through this book because we just take everything it says as gospel truth, right?
Yeah.
We wanted to read through this book because it's such a common reference. It's referenced so often in a lot of prepping literature or as a reference book for a lot of preparedness-minded individuals.
Mm-hmm.
I think the first time I heard about it was reading Patriots by James Wesley Rawls.
Yeah.
And I purchased it and of course left it on my shelf for years. Did me lots of good. So, I'm not hating on it. I mean, we kind of gave this chapter 6 kind of a hard time, and I think it earned it. But I do look forward to I do look forward to the rest of the book. I think there's still a lot to be taken from it. You just don't take anything just because it is the text. We must follow the text. There's more, and particularly when it's a 30-year-old book,
Yeah. This book writing thing is starting to. Oh no, I might have just spilled the beans on the air. No, just kidding. It's getting more and more like there might be some benefit, because that was always my, like, everyone's like, well, why don't you write something? It's like, because there's like already a bunch of shit out there. And now I'm reading through it and I'm like, oh boy, there's okay.
I mean, I think like what one of the students at the class talked about was just like the handout sheets were like, all right, here's your tasks list for starting up a clinic.
Yeah.
That would be a starting point for right up like, all right, how do you set up that? You know, just a book on that topic.
Yeah.
I know a book on making your own alcohol would sell more. I know that would sell more, yes, but it's again, people need.
Yeah.
So I guess next time, antibiotics, what they are and how to use them.
Yes.
Actually, what they are is probably a really good.
Yeah.
Be a good discussion.
I'm excited for that.
So that is page 55 through, how long is that?
3 pages.
You go through 2 chapters.
Is it really only that long?
I think we might be able to stretch out that, because we might,
it's like 4 pages.
Yeah.
It's 4 pages, and then chapter 8, how to measure and give medicine.
So you can really see we're like just doing this as we go. Like I have not read this book before. Yeah, you know what? We'll do 7 and 8 together. I think that'll be, yeah. We can do those too.
Even if they start stretching into 30+ page chapters, maybe you could take more than 3 pages at a time.
Yeah, and there's a lot of pictures in chapter 8, which I enjoy. I like books with pictures. I like books with pictures.
That's how I get through books. I don't like the ones that don't have pictures. I struggle with those.
It's like if the more pictures I have, the less I'm reading with my lips.
Exactly.
My finger just running along under the words.
Yeah, I don't have to like talk as much when I'm going through the book.
Yeah.
So yeah, we'll do 7 and 8 together. That'll be, yeah, we're doing this as we go, guys. You might be listening like, oh man, these guys probably just like read this book and like sat down. It's like, no, man, this is the most where this book has gotten like in the 4 years that I've had this thing.
And I mean, I could be completely misjudging the situation, but I feel like we're probably not alone in that.
Probably not.
Probably not. And the whole, let me buy the book, put it on the shelf, and I'll read it. I'll read it when I need. I'll read it when the balloon goes, and I'll figure it out.
Yeah.
I mean, I think we all kind of do that.
Yeah.
I need to speaking of which, I need to finish reading Mr. Dolio's collection of books up at this point, and looking forward to his first aid book coming out. That should be fairly soon. I'm looking forward to seeing that, because according to his comment on Sons of Liberty last time, I'm expecting my feelings to be hurt, I think he was talking just about like austere care and like something to the effect of like doctors and nurses are not going to like this book. I understand.
I might, when that comes out, we might do a special on that. And just have him, and we'll sit down and go through it and talk about it. That might be its own special episode.
Oh, like have him on?
Yeah.
Oh, that would be cool.
The internet is a wonderful tool.
I was just gonna like snipe at him from the interwebs.
Oh no. We will get the authors, because I actually, as opposed to, well, God, oh man, my mouth almost got me in trouble just now. Let me rephrase what I was going to say before I say it.
Yeah,
I'm a little bit more commonly politically aligned, and I care to hear his other opinions. Because I've just, man, we're 6 chapters in, and there's already like, I'm gonna get myself in trouble if I continue with that. He's probably a good doctor, and I'll leave it at that.
Chew the meat, spit out the bones.
Oh, he's probably a good doctor, and I'll just leave it at that. But yeah, so
as far as this David Warner.
Yeah, the author of this book. I'm sure he's a great doctor.
Is he a doctor? Is he a physician?
If not, I was making some assumptions.
I'm gonna look it up. Like I didn't find any evidence that he was.
Oh God, that's gonna make. Oh no, it's gonna make this even worse.
Let's just take a look here. David Warner, because I got more the impression like that this was written like some sort of, I don't know, Peace Corps or like, volunteer worker, right? All right, author of the book, Donde no hay doctor, co-director of health rights. All right, adjunct associate professor, Boston University School of Public Health, so public health guy, which is not surprising. A biologist and educator by training. He has worked for many years in rural health, community health, village healthcare.
He's public health, he's not a clinician.
Yeah, so he's a public health guy, not a clinician, basically. Which
Okay, things are making a
that
lot
makes-
more sense now.
that's what I would expect based on reading this book. That's
That's
really more
okay.
the sense that I got was like this is a public health focused book.
Things are making a lot more sense now.
Mhm. Yeah, no, I didn't
Lot
choose
more
the position.
sense.
And
I don't know why
about-
I did. I don't know
I don't
why.
know about the other co-authors, Carol Thuman and Jane Maxwell. I don't know. They, as far as I remember, oh no, I'm thinking of another book that they said they had a lot of reviews on. They had like a lot of other, had a lot of clinicians and specialists. That was improvised medicine. Had a lot of specialists review those chapters. I'm not sure who, if anybody, reviewed these, but
Somebody reviewed the midwifery chapter, it's actually good.
okay. The midwifery chapter is good. All right, so I look forward to hearing about that. Kind of makes me at some point, want to get there where women have no doctor or where there is no woman's doctor.
Yeah, that one. I'm interested in that one as well.
That looks worth especially.
All right. This will conclude. We've been, wow, man, for small chapters, we really found a way to stretch this one out quite a bit. I feel like this one's going to get probably the best review because we talked about a lot of stuff other than what was in the chapter.
Well,
oh man,
if people enjoy it, that's great.
That's all that I really care about is people
Appreciate,
enjoying it.
Yeah.
I'm enjoying making it. So honestly,
Yeah.
you know what? Let me rephrase that. I enjoy making it. That's really all I care about.
I enjoy making it, and I enjoy being here, running my mouth. And if people enjoy it, that's fantastic. If they actually
added
learn
side
something from
benefit.
it, even better.
Yeah, that's true. Okay,
But-
so
So I'm
yeah,
just
that'll
here.
conclude another episode. I hope to catch you guys again the next time. If you guys like the new format, please let me know. If you have any comments, I'd appreciate those. Complaints, don't really care about that. I'm just kidding. If you have any comments or concerns, show format, I'm still trying to figure it out. Contrary to popular belief, I have absolutely no idea what I'm doing.
It sure is entertaining. The ride is really entertaining.
yes, it is. So yeah, I look forward to seeing you guys the next time. Anybody else have anything they want to add before we close it out?
I'm an old soul living in a new world.
There might be some emails going out. There might be some emails going out after we close this. Okay. All right. Thank you guys. See you again the next time.
Thank you for listening to this episode of the Stuck Pig Academy of Medicine. If you would like to join the Patreon, the link is in the show notes. Also, check out my training calendar for in-person classes. We'd love to have you.